Hey, hi everybody. Hi, this is Dr. Ken Muich, Fibromyalgia Wellness Center, and this is number. This is funny. This is number 80, believe it or not, our live videos. And last time we actually were supposed to talk completely on omega-3 fish oil, but I started out actually talking about new diseases, and it ties in with fibromyalgia because of the struggle that fibromyalgia patients have with doctors with improper diagnosis or unaccepting fibromyalgia as a condition or a disease. And I mentioned the most recent one, which would be called AFM, acute flaccid myelitis, which affects mainly children between the ages of, I'd say, 5 and 15, 16, 17, 18, as such. And it's almost like a form of polio. And it's apparently neurological and viral, and affects the lower limbs, upper limbs, and also sometimes the breathing capacities, where children are just not able to function. Their brain is fully awake, but their body's just not functioning correctly. And they're still trying to find out answers. But anyway, let's get into the rest of the omega-3. Now, I talked to you about omega-3 being actually involved with two aspects. One is called EPA and the other one DHA, eicosapentaenoic acid, docosahexaenoic acid. That's the terms that are actually used for those. And they're very, very specific and precise, differentiating themselves. They have to understand, as I mentioned to you, this is not something produced by your body. This has to be ingested. This is something that's not produced by the body in itself, and you have to get it into your system. Why is it important? Well, the EPA portion, eicosapentaenoic acid, as I mentioned, is a natural anti-inflammatory. It neurologically, it blocks the brain from producing something called arachidonic acid, which then produces prostaglandins, which is your primary source of inflammation and pain in the body. Now, you do need prostaglandins, but not to such a degree that it causes neurological deficits and so forth, and pain. And so the inflammatory portion is very, very important if you take enough. Now, taking enough is very, very important, as I mentioned to you. You can't just take one pill, omega-3 pill. You have to take as much as 3,000 milligrams. Now, how do you know how much 3,000 milligrams? Well, I have an example. There's a bottle over here, and on the back side, you will find, okay, that the letters EPA and DHA are in here, okay? Now, that will tell you how much is in each capsule, supposedly, okay? So if it says there's 300 milligrams in each capsule, okay, of EPA, then you look up here and you say serving size, okay? And serving size, in effect, this is an example, okay? Serving size is 1, but some actually have 2. So if it says 300 on here milligrams, that would mean that each pill is only 150, all right? So you have to understand, you have to look at the back in 2 areas, how much the actual amount of EPA is in milligrams, and then look up and on the top here, and it says what is the actual aspect as far as the amount of serving. So if you have 500 milligrams, okay, 500 milligrams and 1 serving, well, you just divide that into 3,000, and that would be 6 of them. You'd have to take 6 of these. Now, the nice thing about it is the old omega-3 pills were like horse pills, really huge. These are called pearls. You see how small those are? Really quite small. Now, you don't have to take them all at once. You can take them during the day. You can take 1 6 times a day as an example, or 2 3 times a day, or you can take them all at one time. Doesn't make any difference, okay? Bottom line is to get them into your system. That's the most important thing. Now, the other aspect of omega-3 is the DHA, docosahexaenoic acid. And again, that's on the back over here also, DHA, and it tells you how much. Now, invariably, the DHA has a lower level of milligrams than the EPA. I've really not seen one where it's the exact opposite. That means, again, you follow the same rules and regulations. How much do you need for the DHA, docosahexaenoic portion? 2,000 milligrams a day. 2,000. Now, usually, this is almost 100%. If you're taking enough EPA, you'll take enough DHA. So you don't really have to compute that out if you don't want to. But bottom line is, if you want to, you just figure it out over here. If it's 300 milligrams and you need, and each one is a serving, so forth and so on, whatever it takes to get 2,000, okay? Which would be 6 or 7 of them, okay? But that's how you figure out how much you need. And to look at the back, it should have both EPA and DHA. Don't go by the front. The front will say, oh my goodness, it has 2,000 milligrams of fish oil. Well, sometimes it doesn't really have that. It has it in certain aspects. It might have ALA, which is a portion of shall we say, it tries to be an additive of fish oil itself, but you have to take way too much. It's not a specific amount, but if all the other things that are added up to maybe 2,000 milligrams, okay? But the most important that you're looking at is the EPA and DHA portion, and then the servings. Now, why is it so important for DHA? Well, it's very, very important because it's actually important for the development of the brain, for the normal functional development of the brain itself, and, believe it or not, the retina, the eye, okay? Now, as I mentioned to you again at the last talk, the omega-6, omega-3 ratio should really be 2 to 3, 2 or 3 to 1. If you get a 2 to 1, 2 omega-6 to 1 omega-3, that would be perfect. You can go up to 3. But because of today's Western diets, believe it or not, the ratio in the Western world is usually anywhere from 15 to 25 to 1. You're on fire. You're in an inflammatory bush, for crying out loud. Because keep in mind, the omega-6 stimulates the brain produce prostaglandins. So we didn't have this before. This was a developmental thing. Matter of fact, during the obviously caveman age, so forth and so on, everything was really omega-3. Even our plants and so forth were omega-3. But over the last 150 years, our diets have changed dramatically. And in doing so, you have a big ratio change of omega-6 over omega-3. Now, DHA accounts for about 40% of the brain. Actually, 60% of the brain is really fat, but 40% of the brain is really DHA, and that's extremely important for brain function, for actually memory, whether you're young or old, cognition, eye health, healthy skin, and improvement in ADD and ADHD. Yes, this will actually help. I had a grandchild who for the first year and a half hardly spoke at all. And so in checking, and I'll get to this in just a moment, it was too close to the previous child, the first child, and so I put him on high doses of omega-3, and literally within 3 months he was like a magpie. This is not uncommon. This is not uncommon. Now look, keep in mind, if you expect to be pregnant, or if you already have a child, and you're planning on a second one, there should be anywhere from 18 to 22 months separation between children, because you will not have enough DHA in your system, and so that child could possibly have some deficits, some brain deficits, neurological deficits, hand-eye coordination, learning IQs. They've actually shown children that have given high doses of omega-3, actually their IQs, or that actually had high levels with their parents, actually have higher IQs than those children that do not. The early life brain development is really extremely important in this, in having DHA on hand for development. Now, to giving omega-3, and I've mentioned this before, to autistic children, Alzheimer's patients, because of reduced cognition, declining cognition, also depression, and just overall mental decline, if you don't have the fish oil or DHA. So as you mature, it's just as important as when you're younger. Make sure you have enough omega-3, EPA, and DHA in your system. And it has been shown, research, this is all research, to actually reduce the loss of memory and also cognitive decline, hand-eye coordination, so forth and so on. Again, what do you need? 2,000 milligrams minimum per day. You can take more. They actually did some studies years ago where they actually gave research I gave patients as much as 7,000 milligrams, and there was no side effects. Now, if you're on blood thinners and you're going to have possibly surgery, then get off of omega-3 because there is a problem with that. Otherwise, you can take them regardless, okay? It's not going to really hurt or harm you. Now, there is a difference as far as quality is concerned. It takes 1,000 pounds of fish oil to produce 100 pounds of pure fish oil. That means there's no additives, no chemicals, no aluminum, no runoff from water sprays and so forth, nothing. But they don't throw the other 900 pounds away. They actually have them based upon grading, how much time they spend to take those extra additives and garbage out of the omega-3, out of the fish oil. And they're usually based on A, B, C, and I think there's also a D. Now, the nice thing about it is that the difference between the high grade and that which still has some chemicals in it is not that much different as far as price is concerned. We only work with very specific companies that make sure that everything is pure. We've checked it, evaluated it, make sure we don't want to have patients taking things that, number one, are not 100% pure, and two, that might have some things in it that actually adversely affect the patient itself. So we want to make sure of that. So our products, I don't know if you can actually get them yourself. They're from a company called Zymogen, but ours are just like getting them off the shelf. They're not that expensive. They really are not. But they also have the qualities that I'm talking about to help you. So you're not wasting your mind. You're not wasting your time or money. And yes, you will have a better mind in taking these. So the bottom line is that a lot of this is actually controlled by your diet, as I mentioned. And you can help the reduction in a lot of the things that we're talking about, like hand-eye coordination and memory and cognition and so forth, by staying off of certain things that are inflammatory, not only for your body, but also your brain. For example, you want to minimize your trans fatty acids. Now, that's usually two things. A lot of people say, what's trans fatty acids? Well, it's usually red meat, and also anything really that has a shelf life. That's what gives it a shelf life. In the old days, they didn't put that many things on the shelves because they would only last for a short period of time because they go bad, they get moldy. Well, trans fatty acids minimize that. That's why you have cakes and cookies and candies, all those things that are out there on the shelves, and they seem to last forever. And it's because of trans fatty acids. And trans fatty acids are not good. They're omega-6, and they will cause inflammation. I know that's going to be a problem for those people that like cookies and candies and cakes and all those things. But I'm just trying to help you with your health, okay? If you have fibromyalgia or any other condition, whatever it might be, almost all conditions are based upon inflammation. If you're tired of being sick and tired, then follow what I'm trying to give you. It's important, okay? You want to also reduce saturated fats. Many people are ingesting too many cereal grains. And the problem with that is all the other things that are added to it. Again, trans fatty acids, all the sugars and all the things that, my goodness, they're coming back strong again, and they're not really good for you, okay? And also reduce your intake on soybean oil, sunflower oil, safflower, corn oil, and linseed oil. If you want to have oils, okay, extra virgin olive oil, that's probably the best thing that you can do, using not only your cooking and so forth and salads. And now they have actually extra virgin olive oil that you can cook at higher heat, so to speak, so it doesn't burn, and that's important. What you can do dietary-wise, well, not only ingesting omega-3, but also ingesting, obviously, omega-3 fish, and multiple benefits from that in itself. Multiple benefits, not only those that I told you, anti-inflammatory, and also for brain, but there's so many other things, a healthy skin, eyes, and just overall prevention of other conditions and diseases in itself. And other thing is, carbohydrates are extremely important. Carbohydrates, of course, are your fruits and vegetables, but you want to stay off starches as much as possible, and you want to concentrate on low glycemic fruits and vegetables. and we already covered that. If you want to look it up, just look under, Google. Everybody Googles everything, what low glycemic means. Usually, if you rate anything from 0 to 100 based upon glucose, you want to stay under 50, and that's the most important thing. So, omega-3 has so many positive things with it. Not only that, but the research on it is just continuous. It just keeps on coming out. There was one aspect of omega-3 that people say, I don't want to take that because you take that and you belch and that fishy taste and everything else. They took that out of these things, okay? They've taken it out of that a long time ago. If you say, well, I'm allergic to fish oil or omega-3, check into it, because they've also reduced that capabilities as far as your allergies are concerned. I want to check into it, check with nutritionists or someone as far as specifics are concerned. But most of the time now, they've taken out not only the belching and burping, but also the allergic aspects of fish oil in itself. So, that's the most important things. We're going to continue with this because this is part of our program, that we're actually taking our program apart and reviewing it and explaining to you why we're doing certain things. Why do we take people off of why do people take off of sugar, gluten, trans fatty acids, and dairy? Why do we place them on high levels of omega-3, magnesium, malic acid, and other aspects of things that we think will not only help you health-wise, but overall health in itself, as far as reduce the inflammation and start helping you feel better. I noticed that more and more people are taking CBD, and for those people that are in a lot of pain, CBD is good. In our protocol, you have to stay off of salicylates, and guess what? CBD is a salicylate-based product. It's a plant, okay, and you really have to stay off of that. However, if you're in really acute pain and you're really hurting, and you know that CBD does help you, then use it, at least until the pain is calmed down, wherever it might be. Even Dr. Saint Amand and the Research Center believes that. Look, whatever it takes to calm down your symptoms, and then get off of that fast as you can and get back on our program protocol that we're covering. I want to thank each and every one of you again for joining. Again, we took a little bit extra time, but it looks like it's about 17, 18 minutes. Hope you enjoyed this. And we save each and every one of these, and you can you can join in the discussion. Don't be afraid to come in and let us know you're there, or ask any questions. We'll get right on them. Next time, we're going to talk a little bit more about trans fatty acids, what it entails, and also we're going to start talking about sugar. Not only the regular sugar, but all those fake sugars that you have. I want to thank everybody that's joined me, and everyone that has sent messages and notes and so forth. Really appreciate it. Look forward to seeing you next week, okay? Same time, same station, same bat channel, 12:30 p.m. Arizona time, and we'll be covering more subjects that are not only involved with fibromyalgia directly, but indirectly to many other conditions. Keep in mind, the omega-3 is a positive for anybody that has any inflammatory condition whatsoever. It's not going to hurt you. I want to thank you again. Have a great day. See you next week. Bye-bye now.